Hi, welcome everyone to today's webinar, Adolescent Substance Use Screening Tools, a review of brief validated tools. I'm Tracy McPherson, and I'm going to be your webinar presenter today. I'm Senior Research Scientist at NORC at the University of Chicago, and I provided my contact information here and my email. You're welcome to contact me at any time about the information in the session today or for other information about adolescent screening and brief intervention. Today's webinar is produced in partnership with the Adolescent SBIRT project, the Brief Intervention Group, or the BIG Initiative, and NORC at the University of Chicago. Our webinar is sponsored by the Conrad Hilton Foundation, and we invite you to visit our website at sbirt.webs.com and to email the SBIRT team at NORC at sbirtteam@norc.org. So today's webinar is the first in a series that we'll be bringing you in the coming months. The first one is today. We launch with the Adolescent Substance Use Screening Tools, and you'll see that we'll be bringing in additional items into our webinar series this year, focusing on the integration of suicide prevention into the SBIRT model, primary care professionals' readiness to integrate behavioral health, and looking at adolescents and young adults and opioid use. In addition, we'll be talking about contemporary trends in prevention and treatment, exploring risk factors and co-occurring conditions. And we'll also be talking with you about integrating adolescent SBIRT education into health professional training and looking at national effort to prepare the workforce. So I invite you to take a look at all of the webinars in the series. You can go to sbirt.webs.com/webinars to get a description of each one of those, learn more about the speakers and read their biographies. And I encourage you to sign up and register for all of them. And we invite you to share the downloadable flyer that's available on the website with your colleagues, with your students, anyone that you think who could benefit from the education. You can access today's materials, including the PowerPoint slides, other materials and resources that we're going to be talking about today from the website where you registered for this webinar. So sbirt.webs.com/adolescent-screening will be a dedicated page specifically for this webinar. And you will already see, if you haven't checked it out already, that the PowerPoint slides are up there, and copies of the various screening tools and some of the other complementary resources that accompany them are already up there. After this webinar concludes, you'll receive a follow-up email from us, and that will contain instructions for watching the on-demand recording, which we invite you to share with colleagues, staff, students. And as a part of that email, you'll also learn about how to obtain a free certificate of attendance. And we'll ask you to complete a very short, very brief evaluation survey. And we would really appreciate you taking just a minute to complete that survey. It really helps us to continue to evaluate the kinds of education and professional development that we're providing you. And it's really important in informing our work going forward. So during the webinar today, you'll be able to ask questions. You can do that through the questions pane in your GoToWebinar control panel, on your computer, or on your mobile device. Someone from our staff will respond to you as soon as possible after the webinar concludes. So there are several learning objectives for our session today. We're going to explore some of the brief validated screening tools, some of which you may have heard of, you may be somewhat familiar with. Others are going to be new to you. And the tools that we're going to talk about today are really looking at a sort of a full range of adolescents, including adolescents, the younger adolescents, as well as older adolescents into young adulthood. And they screen for a range of substances, not just alcohol, but you'll have lots of options in these screening tools to identify use for a full range of substances. We'll also show you information about how you can access free materials and resources that are available to support health professional training on adolescent screening and brief intervention and referral to treatment. And we try to make everything that we have talked about here today available to you with easy access from our website, and we'll tell you about that. And we invite you to share these materials with your colleagues, with your students, and we welcome any additional materials that you might have to offer us. We're glad to include those as well. Here is one of the terrific resources that is available to you, and you may be familiar with it already, and if you're not, you will be able to request a free electronic copy. The education that we'll be talking with you about today is really designed to complement the Learner's Guide to Adolescent SBIRT. You can use it to supplement what you're learning through the screening module in the Learner's Guide. You can use it as a standalone tool. What we're trying to really do is really try to provide some complementary resources that will not necessarily duplicate what's in the Learner's Guide, but that will expand the learning even beyond what's already included. You can request a copy on the sbirt.webs.com website /curriculum, or if you go to the main website, you can click on the tab Curriculum and you'll be able to request a copy. In addition to a copy of the Learner's Guide, you can request a copy of the companion PowerPoint slides, which you can use for educating and training others. The full slide deck is available to you, and we welcome you sharing that information with your colleagues and asking them to go to the website and request their own copy. The education also presented today complements the SBI with Adolescents online simulation training that we developed in partnership with Cognito. If you're not familiar with it or you'd like to learn more, you can go to the Cognito website at this address, and you can watch a trailer or take a demo. In addition, when you're on the sbirt.webs.com website and you're on the curriculum page, you'll be able to download a flyer that looks like this on the right that provides information about the learning objectives and what the simulation scenarios are about. And if you have any questions about that, you're welcome to contact the SBIRT team, and we're glad to talk with you about that more. The Learner's Guide to Adolescent SBIRT is comprehensive. There are 5 modules that cover every component of screening and brief intervention and referral to treatment, as well as motivational interviewing strategies. And we also provide some background literature around what is SBIRT for those who may not be familiar or you're teaching it to others, why use it, and it summarizes sort of the case for conducting screening and brief intervention with youth. So in addition to that, each module has comprehensive education and training content. There are learning objectives that you can use to implement within your own course. Like if you're one included on your syllabus, you can use it as part of developing your own training. And there are suggested background readings, as well as sample interactions and conversations and dialogue that allow you to practice, work in dyads and triads, or even just to do self-paced learning to get a real feel for how conversations with adolescents feel. There are also lots of role play activities which can be used in training and education and for your own learning. on the sbirt.webs.com website, you can visit the resources section. There are numerous resources already there. Many of the screening tools are posted there. We also have position papers from American Academy of Pediatrics on their position around screening and brief intervention. We have webinars that are on demand. We have videos. We have lots of very interesting resources that I hope that you'll take advantage of and that you will be able to share with your colleagues. And if you're really interested in getting a bit of a digital tour of the toolkit as a whole, we have a recording available on demand that we did in partnership with IRETA that will walk you through the different components, and you can share that with colleagues as well so that you all can learn about what's available to you. So the American Academy of Pediatrics and the American Medical Association and other federal agencies and organizations recommend that pediatricians and other healthcare providers who work with children and adolescents conduct routine screening and brief intervention using motivational interviewing techniques, and that they be familiar with a network of treatment providers so that they can provide outside referral. Today's session is really going to focus on the first piece of this recommendation, which is on substance use screening. And for us, substance use, we are defining very broadly, and this includes alcohol use, tobacco use, nicotine, prescription medications, and other illicit drugs. So we'll be talking about screening tools that really cover a wide range of substances. The tools that we're going to explore today are the CRAFFT tool. And you may find this surprising that there are multiple versions of the CRAFFT. There's the original CRAFFT, the 2.0, the 2.1, and the CRAFFT+N 2.1, which I bet is quite familiar to unfamiliar to many of you. So this is a really good opportunity to look across the CRAFFT tools, talk about the differences, and you'll see that some of these may be more appealing than others and may actually fill a need that you were looking for in the CRAFFT that you didn't know existed. And so now you'll have the ability to pick and choose among the different tools to fit your needs. We'll also talk about the S2BI and the American Psychiatric Association emerging measures, one in particular for children and adolescents. And we'll provide some information on the BSTAD and some other tools that are available to you that we may not talk about in detail, but we want to make sure that you are equipped in your toolbox with the information. Okay, so let's dive in and talk about the CRAFFT. So the CRAFFT original version, this probably looks pretty familiar to you. The CRAFFT is designed to ask age-appropriate questions about risky alcohol and drug use. And the one that you see on the left is often used as a pocket card. And so some of you may be particularly familiar with this version. And you'll notice that the CRAFFT is 6 items, and it really is an acronym that helps the health professional remember what each of those items are. So across all of the different versions, these items are consistent in every version. So we're really exploring with the adolescent whether they've ridden in a car with someone or including themselves after using alcohol and drugs. Had they ever used alcohol or drugs to relax or feel better about themselves? Had they used alcohol or drugs while they were by themselves or they're alone? And do they forget things while they're using alcohol and drugs? And does their family or friends ever tell them they should cut down on their drinking or drug use? And have they ever gotten in trouble while using alcohol and drugs? So you can see that this tool, you can see in the red font and large capitalized letters, that this is an acronym that's really designed to help the professional remember what CRAFFT stands for. It's a great mnemonic, and it's consistent across every version. So let's look at the version on the right. Now this, if you didn't recognize the one on the left, you may recognize the one on the right. This is the same tool, except for in this particular version, there's a Part A and a Part B. And we're going to be talking about the differences in this format across the different versions, with the similarities and the differences. And this is where you'll be able to really kind of focus in to identify which of these tools best fits your needs. But first, we want to acknowledge the vast amount of work, the development and validation work by John Knight and his colleagues at the Center for Adolescent Substance Abuse Research at Harvard Medical School and Boston Children's Hospital. There's quite a team of people there that support Dr. Knight in doing this work. And I encourage all of you to visit the CRAFFT website if you haven't. It is really an impressive website with numerous publications, presentations about the validation and the use of the tool. It has more than a dozen translations, and you can see that it's presented by language in both the self-administered format and the interview format. And so there really is there are a lot of resources there that you should tap into if you haven't been to the site before. And this site not only includes information about the original CRAFFT, but you'll see that the CRAFFT 2.1, 2.0, and so forth are also available. Now, the CRAFFT is very useful for adolescents and young adults under the age of 21. And it's important to note that all versions of the CRAFFT should be administered using the specific wording as written, because we want to make sure that we're not deviating from the intention of the way those items were delivered, because it could alter the type of response that you're going to receive from the adolescent. And I would say, as a kind of a general statement, for most tools, validated screening tools, unless they're designed to be delivered in a conversational format, you should always keep in mind that the wording is very intentional and that you should stay as close to those words as written. So let's dive in a little bit more into the CRAFFT and understanding how it differs from 2.0 and 2.1. Okay, so starting with, just to refresh, this is the original version, and what you're going to notice in particular, as I mentioned briefly, is that Part A is where you're going to see the most changes, and this is where you're going to explore which one is the version that meets your needs. So one of the things I would mention, though, as you think about switching, okay, I've talked to lots of folks who say, well, we have the CRAFFT, we've been using the CRAFFT, you know, it's a gold standard, it's in our electronic medical record, it's in our workflow, it's institutionalized, there's no way I can change it now. And I can appreciate that challenge. And so it is a process, and you'll have to really think about which version is the right version for you. But I do want to mention that the developers are strongly encouraging health professionals to move to the 2.0 from the original. And there's some reasons why that is. And in particular, that you'll find that as the version changes, the research is showing that it is more sensitive, has better sensitivity and specificity, as they've been able to modify the wording and how they gather information about alcohol, marijuana, and use of other substances. And we'll talk about that in a minute. I want to point out that all the versions have a Part A and a Part B, and that is consistent all the way through every version that we're going to talk about. Okay. In addition, you'll notice that if you don't know, that the CRAFFT original comes in both a interview version and a self-administered version. And this is important because it may, one or the other may fit better into your workflow than the other. It's also been administered in electronic format if you have the capacity to do that. Now let's focus on Part A. So Part A in the original version is asking whether or not, yes or no, has the adolescent used alcohol, marijuana, or other drugs in the past 12 months. And in this particular version, you simply add up the number of yeses, or if there are none, then it's a 0. And that helps you determine whether or not you're going to advance to Part B. So if the adolescent says yes to one of the items in Part A, then you move to Part B and ask the remaining 6 items, which is the mnemonic, the CRAFFT mnemonic. If the adolescent says no to all 3, it's important not to forget to administer the CAR question, which is the first question in Part B, because even adolescents who do not use substances are at increased risk for injury by riding in a car with someone who has used alcohol and drugs. So it's important not to skip that item. Okay. So as I mentioned, the scoring is very easy. You're simply adding up the yes responses in Part B, and that generates the CRAFFT score. And it gives you a sense of what's low risk and what's high risk. And so what's really nice about the CRAFFT is not only is it easy to score, but a score of 2 is the cutoff. That's pretty easy to remember. And also, there are a couple of tools that are available to the health professional to guide them in delivering the brief intervention based on the level of risk. We're going to take a look at that. So with the CRAFFT in the interview version on the second page, on the left you'll see that this provides the guidance for interpretation. And it's providing a bar chart that helps you interpret the probability of a substance use dependence diagnosis so that you can provide feedback based on a specific score. On the right is the provider guide, and in this guide is what we refer to as the CRAFFT algorithm. And the algorithm is really helping you to learn how to kind of roll up all the information presented and how to deliver the brief intervention based on the CRAFFT score into kind of a high-level visual that consolidates the information and helps you make decisions about where in the conversation or next step in the process that you're going. Now here is an image, and again, this is available as a downloadable resource to you. This is just to give you a visual image of what you're looking for. And this is really helpful in really guiding you into where the start and stop points are in the process of screening and brief intervention. There are key decision points, and there are specific steps in the process that this flow helps you to make more digestible a lot of information about how to deliver the brief intervention. I would mention that this has been laminated and made as a desk reference in the same way that a pocket card, like a CRAFFT pocket card, is often made available to professionals who need that as a resource when they're working with adolescents and young adults. And we've made a copy of this available, as well as the full provider guide on our website where the webinar is housed. And what I want to mention is that it is actually located on the back cover, and a lot of people don't know that, and they miss it because they think it's just a back cover. It's actually on the back cover, and I really would encourage you to take a look and see if that might be useful to you. the CRAFFT algorithm and all of the materials that are in this provider guide are a collaboration between CSER and the Massachusetts Department of Public Health Bureau of Substance Abuse Services and other partners in Massachusetts, and it's made publicly available. Okay, so let's move to the CRAFFT 2.0, and let's talk a little bit about this. I drew your attention to Part A and the difference, and I was talking a bit about improving the sensitivity and specificity of the tool. And in particular, the Part A has been modified, and what you'll notice is that it no longer asks yes/no questions. It's asking about the frequency of use of alcohol, marijuana, and other substances. And that is the major, probably the most significant difference that you should take note of. And so this is one of the reasons why we're being encouraged to move to the 2.0, because we do have the advantage of improved psychometrics, and that's very useful in trying to help identify adolescents. So in addition, in 2.0, it is also, as you saw, available in the interview and the self-administered version. This version is also validated with adolescents aged 12 to 18, and it continues in the same way as the original to ask about past 12-month use. That's kind of consistent really across the tools. And as I mentioned, it's still the same AB format, and the scoring is the same. So that is, it'll be very familiar to you if you're using the original CRAFFT, but that important difference about Part A is a big distinction. So in addition to the change from yes/no to frequency of use, the other thing that you will see is that Part A also adds now additional examples of substances and clarifying actually specific substances, examples of substances, marijuana and synthetic marijuana and other examples, which can be very helpful when you're delivering, particularly in an interview, but also for the adolescent who's responding themselves to understand what you mean by these terms as substance use changes over time. And so that's been updated. In addition to that, what's been added to 2.0 is some guidance on talking points, the 5 R's of brief counseling. So in the CRAFFT original, you had the bar chart to help you to determine the likelihood of a CRAFFT score, the likelihood of having a substance use disorder based on the score, but they've added these additional guidance to help with delivering the brief intervention. What are the components of the brief intervention? Providing some sample dialogue to deliver it. Okay, in addition to this, the 2.1 version now includes vaping. So it's reflecting the change in substance use behavior over time, and 2.1 now includes vaping, which is something we've heard professionals say they would like to be able to assess. So now we're going to talk about the CRAFFT+N 2.1, which I bet many of you have not heard of. It's not as commonly used, but what's nice about this is that it has not only moved to asking about frequency, but it also has the additional examples of substances, and it includes vaping, and also now includes tobacco and nicotine, use of tobacco and nicotine products. And I know, some have really wanted to be able to ask about tobacco and nicotine, but weren't able to really do that in some of the other versions. So this may really meet your needs if you're looking for that. And Part B remains the same. Okay, so I hope that has given you a sense of the range of versions of CRAFFT that are available to you, the changes that have happened over time, the advantages of what research has helped informed in making decisions about improving the psychometrics of the tool and why that's important. And I hope it meets your needs in assessing a fuller range of substances, which I think many people are interested in. So I encourage you to visit the website for those additional materials on the CRAFFT website, and also to download these. And if you have questions about these, please, you're welcome to reach out to me. I'm glad to discuss them with you further. Okay, so as we talk about an additional tool, now this is a tool, Screening to Brief Intervention, or S2BI, that is newer on the scene, but it's something that we're seeing a lot of interest in, and it has certainly grown in terms of usage in a fairly short, just a few years, in a short period of time. And a lot of work is going into the development and the validation, really making this accessible, both as an electronic tool, as a paper-based tool, making accessible as both an interview and self-administered format. And it's also very brief, which is very helpful. And in the brevity of it, it's nice because it also has a two-tiered approach that we've talked about a little bit. And I think that you'll find that to be a very useful tool if you're not familiar with it. So let's explore that a little bit. It does assess substance use in the past year, similar to the CRAFFT, and it has 7 categories of substances, and it really asks very specifically about each substance. And here it is. So on the right, there are a couple of different formats or versions that you might see out there, and we've uploaded for you a copy of the S2BI Toolkit, which has the entire manual, and it has the questions. It looks a little different than this image, but this is one of the versions that could be easily made into a pocket card. And so I encourage you to, use either of those, but certainly this one is very easy to follow. Essentially, you ask the first 3 questions of how many times have they used tobacco, alcohol, or marijuana. And essentially, if never, you stop and you're done with the screening. Otherwise, you continue to the remaining 4 items, and this is where we begin to ask about other substances, prescription medications, illegal drugs, inhalants, herbs, and synthetic drugs. And you ask each item individually, and you provide the adolescent with the scale of never, once or twice, monthly, or weekly. We've provided a link to the electronic administration that's available, that's supported by NIDA, and that's available on their website. And there's a patient and a practitioner version. I encourage you to explore that. In interpreting the S2BI, the frequency of use identified in the first 3 questions, that's the tobacco, alcohol, marijuana, can be used to assess the level of risk for a substance use disorder. And so you can see here, by looking at the response, never, once or twice, monthly, weekly, or more, that it gives you the sense whether there is low risk of a substance use disorder, risk for mild or moderate or severe substance use disorder. And it also gives you a sense of what level of brief intervention would be the right touch at that level of risk. I'm going to show you a tool that would be helpful in remembering, what the level of touch is for what level of risk. So we refer to it the S2BI algorithm, and in the S2BI toolkit, it does look a little different than this, but this is essentially just a different image of the same thing, and this too can also be put on the back of a pocket card and be very helpful in facilitating administration. And what you'll see is that this is really helpful for the professional to guide in the next steps of screening. So knowing when to ask those follow-up questions that we were just reviewing around specific substances, and really informing the delivery of the brief intervention. Is it positive reinforcement? Do we need to deliver the additional questions? And from there, what's the right touch? Is it brief advice? Or if this is higher risk use, moving into guidance around brief motivational interventions. And so this is a really nice algorithm, very simple to use to cue sort of the process and the delivery of the screening and the brief intervention. So I mentioned the toolkit for providers, and the S2BI looked a little bit different in this nice toolkit manual. We have links for you. This is what it looks like. This is what you'll be looking for, and it really does provide very comprehensive guidance in working through the brief intervention. There's a lot of guidance along the way about specific scenarios in working with adolescents of different age range. And then in addition to that is a companion quick guide. So that doesn't have the screening questions in it, but what it does is it helps really guide the brief intervention once you have the screening score. And you'll see the S2BI algorithm in looks a little different, but it's essentially the same thing. And it's just a very quick two-pager. It could be laminated as a back or front, and very, very easy and useful resource. I'll mention that the S2BI as a screening tool is very useful in and of itself. In addition to that, it's been recommended that if there additional assessment, further assessment, brief assessment is warranted, that it could be paired with the CRAFFT, which we've already talked a lot about in detail, to really do a bit of a further assessment. So those two can be used together. Okay, now we're going to explore another measure which many may not be familiar with, and I refer to these as the APA emerging measures. They're adapted from NIDA's Modified Assist, which was developed by the World Health Organization, the original Assist. So many of you are familiar with that. That was a very, very long and lengthy screening tool that was originally primarily delivered in an interview format. It's pretty intensive. And so this measure that we're going to be talking about really has been coming onto the scene, and APA released a set of screening tools known as the emerging measures, and they're for use in research and clinical evaluation. And what's interesting about some of the measures, we're going to talk about one of them, but one of the other measures that I would encourage you to take a look at, there is a level 1 measure, which not only screens for substance use, but it embeds it in assessing for other things, whether you're talking about depressive symptoms or other kinds of symptoms. It's embedded. It is longer, a little bit more lengthy to administer, but if you're interested in tapping into other dimensions of behavioral health other than just substance use, I would encourage you to take a look. We're going to focus on the specific measure for adolescents, children and adolescents, age 11 to 17. And I will mention, in case you are interested, is that there is another set of measures for parents and guardians of children. So if that's something that you're interested in, you can certainly go to the Emerging Measure website, which we have links for you. But if you can't find it, you can certainly contact me. So let's talk a little bit about the Level 2 substance use child age 11 to 17 measure. That's the title of the measure. And as you can see, it was adapted by from the NIDA Modified Assist. And this is a different time frame. So this is really assessing frequency of use in the past 2 weeks. And you'll see that there are, it really cuts across a range of substances across 15 items. And it's tapping into the alcohol, tobacco, nicotine, prescription medicine, and illicit substances. And you can see when you look on the right that it's very specific. Even asking very specifically about steroids, hallucinogens, heroin. So it's at that level of detail if you're looking for that type of tool. And the adolescent rates each substance on a 5-point scale from not at all, less than a day or two, several days, more than half the days, or nearly every day, again in the last 2 weeks. And each one of those responses corresponds to a score. And so you put that score in the right, and that gives you a sense of use by substance. So the rating of the multiple items, anything greater than 0 indicates greater severity and complexity of substance use when there's multiple items have been rated above 0. And it's encouraged that the health professionals review the score of each item on the measure during the interview process. And scores on individual items should be interpreted independently of one another because each item asks about a distinct substance. So you may be exploring use around a particular substance one at a time. Of course, it may come up as you're having the conversation about multiple substances at a time, but you're encouraged to be addressing or at least interviewing, embedding into your interview discussion about each of those substances that are endorsed. And consistently high scores, so if you're using this over time, would indicate a significant and problematic areas for the adolescent and really warrant further assessment, treatment, and follow-up. Okay. So again, that tool is also available to you to download, and we hope you'll take a look. There's some other very interesting measures if you Google NIDA APA emerging measures, and we hope you'll take a look and explore those as well. Okay, let's talk about the BSTAD, the Brief Screener for Alcohol, Tobacco, and Other Drugs. This is another tool that has been getting a lot of attention. It's been used for a number of years, but I think it's growing in attention, and people are beginning to learn more about it as they are expanding their screening options beyond some of the traditional that have been around much longer. Like the S2BI, it seems to be being explored more recently. And what you notice about this tool is that you can see on the right, it looks more lengthy than it is. I mean, it really does look like it's not that brief if you look at it as a standalone, but when you really dive into it and you look at how it's tiered, it is more brief than you think in delivering it. But before you move into to administering those items, you start simply with, again, in the past year, how many days has the adolescent had more than a few sips of beer, wine, or any drink containing alcohol? Has the adolescent smoked cigarettes or used tobacco products? And they're asking about their use of marijuana. So how many days? So this is an interesting tool because if you're familiar with NIAAA's youth guide to address alcohol use, you will know that in that particular screening and brief intervention protocol, depending on the age of the adolescent, you either further ask questions about their friends' use first, or you ask about their personal use first. And that really depends on the age of the adolescent. And that is essentially what you're seeing here in this instrument is a pairing of the first 3 items with components of NIAAA's use guide. And so that's what I find particularly interesting about this. And I think it provides a very nice tool and a visual that you can use. And again, you could laminate this and make this a desk reference to guide those questions, the administration of those questions. So following the assessment, you would, with the first 3 questions, you would then move to friends use, and this is for the lower age range within adolescence, or personal use if it's in the higher age range of adolescence, so more the older adolescent. And what's interesting about this on the right that you can see is we're inquiring about not only current use, but past 30-day use, past 90-day use, and past year use. So you would get a perspective of use over time for these different substances. So this is supported by NIDA. This screen is also available in electronic format, and I would encourage you to go through it as a patient, go through it as a practitioner, to really get the experience of what it feels like to not only be the person that's going to be responding, but in guiding the administration. And you can use these to really practice and get comfortable, and then it becomes much more second nature to you in administering the tool. Okay. So I know we've covered several tools in this session, but I want to mention a couple more that I want to draw your attention to. And these are covered in the Learner's Guide to Adolescent SBIRT that I talked about earlier. That's available to you in electronic format. You can also order a copy, a hard copy of the Learner's Guide to Adolescent SBIRT. There is an online form that's available to you, and we make that available at cost, at printing cost. And we print them as they're ordered. So these are the tools that are contained in the guide and are talked about in some detail, and also have a number of resources that are provided, links and other materials, including copies of them in the appendix. Some of them are not only in the appendix, but you have maybe a downloadable form online, maybe from NIDA or NIAAA. All of that is provided. So the NIAAA use screen that I mentioned earlier, that is that format that was paired with the BSTAD, that in its entirety is an entire screening and brief intervention system protocol. You could use that in and of itself with no other tools to deliver screening and brief intervention. The NIDA Quick Screen, that's another one that seems to be fairly new to some. And mostly you would, we've seen this being used with the older adolescent, which would be the young adult age and older. It's very quick and easy to use. I find a lot of people really like this tool. The audit, which many of you have heard of, familiar with, often we use it with adults, but many are surprised to know that there has been a validation study with adolescents under the age of 18 with a modified scoring. And so we actually do provide detail in the Learner's Guide about that and provide a link to the original. Just keep in mind that the original is not the same as the U.S. audit. The U.S. audit, which has been adapted for use in the U.S., is a newer version of the original, adapted specifically for use here in the United States because of the way we define our standard drink. And so it's based on drinking guidelines set by NIAAA. And if you take a look, it appears significantly modified, right? So it'll take a little bit of adjusting to look at the scoring and look at the range of responses for each item, but very easy to use, and it kind of takes really the guesswork and uncertainty of adapting the original for the U.S. because we used to adapt the third item on the audit C, that's item 3 of the audit, to align with guidelines for men and women, and this just makes it easy and takes that work and ambiguity out, which I like. Also, the DAST. The DAST is often used with older adolescents or the young adults and adults, but some aren't familiar that there is a 20-item version that has been used with adolescents, and that is made available to you as well. And it has different scoring protocol, perhaps than what you're used to with the DAST-10. Still very easy to use, scored in the same kind of format, but different cutoffs. And then the global appraisal of individual need short screen, the GAIN short screen. Now, this may be new to those who may be more in a practice setting. It's been well validated. It has extensive validation studies, normative data. I mean, if you visit the website, there is a vast amount of information and resources. It's probably one of the most researched tools available out there, but maybe less familiar. Often used in research, rigorous research, and it's very easy to administer. And it does have applicability to a range, a wider age range, but very quick to administer, and really looks at level of risk for mental health and conduct problems, alcohol and or drug use, and crime or violence. So what you're going to, what's very different about this is it's tapping into other dimensions beyond just substance use, and that's very appealing for some. Some of the other tools out there are the TAPs, which we provide a link for you. We don't currently have that in the learner's guide, but we made that available to you. And that is very, very brief. And often I've seen this used with the older adolescent, really that young adult age or older. And then I just provided a bit of a blurb on the BSTAD, even though we talked about it a bit in detail, so you could get some additional links and learn a little bit more about some of the age ranges for which it's appropriate. And then if you are familiar with the NIAAA resource Assessing Alcohol Problems, a guide to clinicians and researchers, there's a list of adolescent measures there. And there's also quite a matrix of tools available on NIH's website, which really allows you to link very directly to tools specific for adults and adolescents, and they're all downloadable, and those are very, very easy to access as well. And we have links to those on our website. Okay. I provided some additional references if you, and these are hyperlinked and all available to you. I didn't mention the U.S. Preventative Services Task Force or some of the other policy statements and guidance by American Academy of Pediatrics, or their call to action published in 2018. But I encourage you to take a look at some of the recommendations that have come out of the U.S. Preventative Services Task Force and the responses that the American Academy of Pediatrics and their positions on screening and brief intervention for adolescents. I think it's a good background and good education for really understanding sort of where we are in the research, the gaps in the research, and the support in the professional community around adolescent screening and brief intervention, and really a call to action for us and where we need to go in helping to build whatever that evidence is, to build that literature base, which is really very important to advancing our efforts around adolescent screening and brief intervention. Also, here are some quick links to CRAFFT tools that are available to you that I encourage you to explore, and including full text articles and presentations, which are very helpful in really understanding how it's being used in different settings. So it's nice that you get the full deck and the full links to a lot of them. and also the S2BI, getting access to that quick guide I mentioned and the development article and learning more about, the validation of that I think is important, so that's there for you. And so I hope this has really provided at least kind of touching and providing a review of some of the, those go-to instruments, some of the newer revised versions of the instruments that you may have been familiar with and didn't know about, some of the more emerging measures or newer measures on the scene that are really getting a lot of attention and being used and continuing to be researched and studied and validated with adolescents. And so as part of our closing in our session today, I just want to remind you that all of these PowerPoints, all of the tools that we've talked about, if you can't find them on our website, you contact us at the SBIRT team at NORC.org, and we'll be glad to make sure that you get those. I hope that you will also request the Learner's Guide and get access to that. And so in addition to all of those resources, I just want to also just thank everyone for participating in our webinar today. And I want to remind you to go and visit the website and take a look at the upcoming webinars, not just this one and when we make it on demand, but the other upcoming webinars I think you'll be interested in. And following, just as a reminder, following the session, you're going to receive an email from us, and that's going to contain the instructions for watching the on-demand recording, how to obtain a free certificate of attendance, and how to complete a short evaluation survey. And again, it's very brief, really important to continuing to evaluating the education and the professional development we're providing you. And if you would like to learn more about kind of the work that we're doing with the Conrad Hilton Foundation, we encourage you to, when you're on our website, to sign up and join our closed list. We have a wonderful newsletter that's sent out no more than 2 times a month with some really rich information, resources, things that are hot off the press, upcoming presentations, things you're going to want to be involved in. So I hope you'll sign up for that as well. Okay, so also I just want to extend an invitation to anyone who has questions about screening and brief intervention and referral to treatment in terms of implementation, whatever setting that you're in. If you're interested in evaluation, perhaps you want to evaluate training and learning and the education that you're providing to others. Perhaps you're interested in evaluating the adoption of an uptake of screening and brief intervention in your setting. You are interested in what are those process measures to monitor implementation and evaluate and monitor progress and uptake. Or perhaps you're interested in looking at adolescent outcomes. Or you're interested in training and want more training information. So I invite you, if you would like, to set up a technical assistance conversation by telephone. I invite you to reach out to me, and I look forward to helping you think through what you're trying to do in your organization. So in closing, I want to thank you for attending today's session. And I want to acknowledge again the support from the Conrad and Hilton Foundation in our adolescent screening and brief intervention work here at NORC, and the collaboration with the Brief Intervention Group. And finally, here is the web address, sbirt.webs.com, and how to contact our team, sbirtteam@norc.org. I encourage you to reach out to us, and I look forward to having you on future webinars. Have a great day.